Who got here right. Welcome to everyone who got here right on time. This is Stacy Chazen with AIDPH, and we're going to give folks just one more minute to join, and then we will get started. Okay, Jasmine, if you'll go ahead and share the slides, why don't we get started with our housekeeping? I know we have a tight, jam-packed agenda for today. Great, thank you. So welcome everyone to this month's AIDPH Rural Oral Health Echo Session, Oral Health Policy and Advocacy. This is Stacy Chazen. I'm the Education Team Lead for AIDPH, and it's my pleasure to be your host for today. Next slide, please. I want to start off by thanking our partners at the CareQuest Institute for Oral Health, UNLV, and the Oral Health Progress and Equity Network. We couldn't do this without you. Next slide. So today's agenda, we're going to go over some housekeeping items and give you an overview of the call. We're then going to hear from Chloe Van Zandt from Virginia Health Catalyst about your role in advocacy and policy change. We'll have some time for a Q&A. We're then going to have our case presentation today to our think tank from our friends and partners at the National Rural Health Association. They're going to be talking about developing advocacy and information dissemination tools, and then we'll discuss their challenge. Next slide, please. Housekeeping items. Today's call is being recorded. We're going to ask everyone, please type your email and organization name in the chat so we can record that you are with us today. All materials referenced on today's call, as well as the recording, will be available after today's call on the AIDPH website. We remind you to avoid any personally identifiable health information in our discussions. And if you have any questions about Zoom during the call, please chat with Annalise Cothran through the chat box. About AIDPH, for those who haven't joined us before, AIDPH is a 501c3 nonprofit that centers health equity as the cornerstone of oral health education and training. And we invite you to visit our website, aidph.org, to learn more. Next slide, please. This Rural Oral Health Echo follows the CareQuest Institute's 3 domains framework using the lens of rurality and health equity, addressing teleprevention, minimally invasive care, and integrated and personalized care. Next slide. Here are the topics, most of which we've covered already because we're already in September. We invite you to visit our website to learn more about what's coming up. We'll be covering next month oral health for individuals with disabilities, and then veterans oral health in November. Next slide, please. Many of you have been with us before, so you know our session norms, where we hope each one of you learns and teaches. We ask that everyone use first names rather than titles to facilitate equality in the discussion. Please add your pronouns to your Zoom name. And when you do speak, we ask that you introduce yourself with your name, organization, and location. But before you do that, please keep yourself on mute. We ask that everyone turn their video on and limit any environmental distractions. And of course, as always, respect one another in our discussions. Next slide, please. So with that, I'm going to introduce today's didactic speaker. Chloe Van Zandt serves as Virginia Health Catalyst's Director of Water. In this role, Chloe leads Catalyst's water equity initiatives to ensure that everyone in the Commonwealth has equitable access to safe, trusted, fluoridated drinking water that is preferred. Previously, Chloe led Catalyst's grassroots advocacy efforts to successfully include an adult dental benefit in Medicaid and increase Medicaid dental reimbursement rates. Before joining Virginia Health Catalyst, Chloe worked in higher education, where she coordinated community organizing to engage students in activism. She earned her BS in communication from Boise State University and her master's in public health from George Washington University. Chloe is a very valued and trusted partner of AIDPH, and we're so thankful that she's with us today. Chloe, we'll turn it over to you.
Thank you so much, Stacy. And thank you all for being here today and for AIDPH for this opportunity. I'm excited to talk about advocacy. As Stacy said, I'm currently the Director of Water at Virginia Health Catalyst, but was previously our Senior Policy Manager and had the privilege of leading some of our grassroots advocacy campaigns to ensure that oral health care can be more equitable and accessible. And so hopefully today, through sharing some of the lessons learned, you'll be able to see how you can play a role and participate in that process. So our desired outcomes are, we're going to talk about the need for a new approach to advocacy, that what we know about grassroots advocacy isn't working, and there's an increased need to focus on community engagement. Hopefully you'll be able to see the role you can play in advocacy and policy change, and how much these movements need to involve your investment. And then we'll also think about ways to apply some of these lessons to your work. So first, sharing a little bit of context. I'm here to share what I learned during my time leading the grassroots advocacy in Virginia to add a comprehensive adult dental benefit to Medicaid. We were fortunate to get this passed in 2020 and expand dental coverage to almost 1 million Virginians, which was a great win, but was not without a lot of work that did take at least 10 years. And so I'll just be focusing on the grassroots aspect that we did in the last 2 years that really got it over the finish line. So when we think about grassroots advocacy, we know that this is a key piece to any policy change, that for change to happen, for legislators to listen, that in general, they rely on hearing from their constituents. We know the need for specific patient stories, and that this work is about building some sort of coalition of support for an issue, that none of this is new information. But through my experience in this work in Virginia, I learned that this model wasn't working for us, that it can take so much work and time to motivate people, to get them plugged in and to be able to rely on them when specific advocacy opportunities come up. I thought at the time in the beginning that I was doing all the right things, but when I realized it wasn't working, it was when I had been having a conversation with someone. We've been talking probably for about 20 minutes, and realized that this person standing in front of me still had no better understanding of why I was asking for them to send an email or call their legislator. And it was because they didn't see themselves as part of the solution and the role that they played. And so hopefully some of what we talk about today, we'll be able to share some of the lessons learned and the need to focus on community building rather than the individual act of advocacy. And that to do this, community building requires a different approach, and it takes a lot of personal investment. And so I broke this process of building community into 3 steps. That you have to first connect people to the issue, and then you need to spend time teaching and practicing advocacy, and then to implement changes well, that we need to implement them collectively and rely on that coalition. And hopefully through this, you'll be able to think about ways in which you can add some of this into your roles. So the first one of connecting people to the issue, this was definitely the biggest lesson I learned, and I think the biggest lesson for Virginia writ large, is that people did not see themselves as a key piece to creating change. I think it's really easy when we're talking about policy change that needs to happen. It's easy to lose people, that we either talk way too much in specifics about the specific policy, or kind of focus on the history of what we've been doing, and are not centering the person that we're talking to in that conversation, and slowing down and taking time to ensure that they're understanding the process as it pertains to them. And so first, starting with framing the issue of just what is the big picture? What's the problem that we're trying to solve and to get people to care about? And then to really spend time finding what resonates with people, that it helps to make it as personal as possible, and recognizing that this can't be done in a scripted manner. It can't just be talking points or a flyer or email that you're sending out, but it really takes getting to know someone to understand their life and how and why they might care about this issue, and that everyone has a different reason to care about the issue that you're talking about. And so if we think about adult dental, for parents thinking about what kids what resources their kids have access to, and maybe if someone in their family or in their extended family doesn't have access to the same resources, when speaking to dentists, talking about the impact on them, on their practice, on their sustainability, and then thinking about, for example, community organization staff, that the policy change, how it aligns with their mission, goals, how it impacts the communities that they work with. And so I think first of spending time on this and not moving forward until people really have a solid grasp of the policy change we're talking about. And then lastly, to really simplify the policy process, to be able to explain how are we going to move from where we are right now to get to that desired outcome, that people need to see those steps and understand them, to want to engage with them, and to understand how change is going to happen and what the future will look like when this change does happen. And so I think that even if you're not a policy expert or policy wonk, if you don't have a ton of time to give, that you can play a crucial role in supporting advocacy groups by sharing your experience, by helping elevate patient stories, by sharing the impact that whatever the policy change is has taken on you, on your life, on your experience. And I think you also offer a really unique lens that often the people leading an advocacy campaign don't have access to and don't know. And so seeing yourself in that and being able to lift up some of those stories. So here's a really, really basic example of something we did in Virginia. These were postcards that I would take to meetings and have people fill out on the back of them some personal story and then mail it to their legislator. And on the front of the postcard was different topics about why this adult dental benefit mattered and how it would affect different populations. And it was through speaking with some of our partners when they asked for kind of these tailored postcards. And I thought, I thought it was silly at the time. We just need an adult dental benefit. This is obvious. But then when I would take these cards to a meeting, the fact that people could see the issue that they cared about most on a card in front of them had a much bigger impact than I ever realized. People would say like, no, I don't want the kids one. I want the special needs one. And I knew like they're all going to the same place. It was all similar messaging. But the fact that people could see themselves in it was really huge. And that as health providers, you know these challenges and issues better than anyone. And so you can help by providing your input to tell this story. And so next is to teach and practice advocacy, to spend time teaching the basics, that to foster community, we need to invest in people. I think people generally like to learn, and policy is often complicated and can give people a headache and seem irrelevant. But if we want to have something that's complicated, demystified for people, that we need to be able to take the time to explain very specifically what that process is, that there is a path from the moment you're in right now if you're asking them to, for example, call a legislator, like who are they calling and why? Are they sitting on a committee? What are they capable of doing? What meeting is happening that this is relevant to? When is a vote happening? Of just kind of laying out those basic points so people can say and understand, oh, I need to make this phone call right now so that this person hears tomorrow before they go into a meeting, and hopefully they hear from hundreds of people that this is important, and so that it's top of mind from them. And I think that often that piece is really lost. And then there's also a need for constant communication, that if you're asking someone to do something, to follow up and share what has happened, to share updates. If this is what we know at this point, or even I don't have an update yet, like things are happening behind closed doors. We're still kind of waiting. Thank you so much for being involved. I'll let you know as soon as I have an update. And so if keeping that line of communication really open, as opposed to just asking for something and then kind of failing to go back to it, that I think that's easily how people get disconnected. And then lastly, that we need feedback. We need to know if things are working. And I think you're in the perfect position to share some feedback. Like, are you understanding the process? Are you able to communicate about this change at the dinner table or to partners? And do you see yourselves in the solution? I think that sometimes advocates aren't always who we think of first. There was an example in Virginia during this adult dental benefit campaign where a woman who runs a community foundation reached out to me to talk through her story, that their foundation had been subsidizing the local clinic's dental program, and that the foundation was running out of money, that due to increased dental costs, she told me point blank, like, if adult dental doesn't get passed, we won't be able to subsidize this dental clinic anymore. And that clinic served 3 counties. It was the only clinic in this rural area. And so I was able to connect her with some very specific legislators to say, like, this is the impact this dental benefit will have, but that connection wouldn't have been made if she didn't see the role she was playing in it, of being potentially more removed than patient, dentist, clinic, funder, that I think it's easy to not see that. Luckily she did, and so we were able to connect her, but to always kind of look for those partners that are maybe not as top of mind. And that all of this is personal investment, and this is what creates partners and friends in this work, and this is community building, that it's not just kind of one and done advocacy, but that it's different from at least the grassroots models that I'm familiar with, where you get an email and say, like, quick, email your legislator, and then nothing. Like, I only imagine that email blast is getting sent to thousands of people, and I would imagine almost no one does it, like, other than maybe people like my grandma who get up every morning and email their legislators, but that there's no connection in that process. And so while this is definitely time consuming, it really helps to ensure that people are committed and bought in and really understand what they're being a part of. And then lastly is to implement collectively, which I think this often gets overlooked, that if a group is successful in getting a policy change passed or a piece of legislation passed, that often we see grassroots programs kind of ending, but that the work is not done. And in some ways it's just starting. Like, this is just, okay, the ball got rolling, we got this passed, and now it's going to be a long road of working out the kinks. And what does this look like? And so that you all as the community are the ones implementing these changes. And I think this is where these strong relationships are needed the most. And so first, to be able to communicate the changes of who needs this new information. And often I think it's sent only to the people that are required to know it, but thinking, like, who else is affected, and to think of everyone involved. So in Virginia, when we were talking about adult dental, of reaching out to our Department of Social Services and talking to social workers and case managers and food bank staff and community organization staff? Like, do they know that this change is coming? Are they equipped to communicate about it and share resources? Additionally, on a call, a woman asked us, like, are you speaking to hygienists or just dentists? Which I thought was a great question. If dentists are the ones providing care, that's who was required to get the email, but that we were able to put on a whole webinar just for hygienists of like this change and how you can communicate with it, and to bring in your front of office staff, that they're the ones that are going to be fielding questions the most. And so really spending time on thinking about all of those different people involved. And then also who needs support, who might need an FAQ page or a how-to page or a webinar, and what can you do to ensure that they have the resources they need. And then again, feedback of what's working, what's not working. I think we definitely had some wins and some challenges in Virginia with this. Like with any big policy change, it's really difficult to get the word out to everyone, but it's working really hard and hearing from partners of, we need a unique one pager in this language, or like I'm having a meeting with our pregnant people population, and so I need a one pager about the dental benefit and how it affects them. And so really being keyed into that and listening and realizing that, like, just going back to the building community, that these lines of communication often don't just exist immediately. I think as professionals, often when we're faced with a challenge, it's easy to kind of go around it and think like, oh, I'll, work through to find a different solution, as opposed to lifting up that challenge of saying, this is the problem. Is there some way that we can fix this together? Of recognizing that if you're having this challenge, probably lots of other people are having it. And so to keep those lines of communication open, that there's a place to give that feedback to, and that people are listening to it. And then I think lastly, I just love this quote, that all advocacy is at its core is an exercise in empathy. Of often it seems like advocacy is either a once a year issue or a single topic issue, depending on what people are talking about. And just knowing how everyone is so busy, everyone is fairly overworked, feeling some burnout, that all of this takes a lot of time and energy, but that it also takes contributions from everyone for positive change to happen. And so just spending time in that space and leading with empathy as we reach out to new partners, as we talk about changes that need to happen, as we connect people to issues, of recognizing, like, of course, we all bring our entire lives with us to every conversation we have, and to save space for that and meet people where they are. And that through one conversation at a time, we can build a really strong community that's capable of a lot more change and a lot more sustainable change than just the basic grassroots model, send an email, call a legislator, leave it at that. And so those were some lessons learned in Virginia. I hope that there was potentially some takeaways for you all, and seeing advocacy and policy change a little bit different. But with that, I will thank you all for your time and move into questions.
Thank you so much, Chloe. I'm going to ask that you unshare your screen so we can all see each other. Yep. And then if anyone has a question to ask, if you can use the electronic hand raising function, I can see all of you, and we'd love to answer them. I want to start off by saying I loved how you opened with the observation that people didn't really see themselves as part of the solution and playing a role in advocacy, and what an aha moment that is to me, and it sounds like it was to your team as well. So that's just an observation. And then I'm curious, well, I have two questions. One is the postcards that you shared, I wrote in the chat, those are phenomenal. They're not only beautiful, but the messaging on there is just really, really well done. Are those available to share with folks so that they might model their own postcards after them?
Yeah, I think they're still on our website, but I'm not sure. So I'll check, and I'll definitely share them with you, Stacy, and anyone can use them. And have access to them. And so I'll make sure that those are shared.
Great. Thank you. So I don't see any electronic hands up, so I'm going to just ask my next question then. And that is, I wonder if you could share any advice about identifying and then cultivating relationships with the community partners who are the gatekeepers to the folks you want to be engaging.
Yeah, I think my experience in Virginia was kind of relying on the network that we had of who did we have in these different spaces. And often those are just, relationships that are built over time, and then seeing who they could connect us with. In my experience, it seems like cold calling is one of the least effective methods. And so saying, like, we know this person at DSS, are you able to connect us with someone else? And then through that process was able to get connected to all of the social support caseworkers at their monthly meetings. And so through a couple of months, I was able to present in front of at least all of the people that showed up, but ostensibly all the caseworkers in Virginia. And so that at the very least, they could have some basic information if I remember someone talking about that and know who to reach out to. But was just definitely a process of kind of trial and error and brainstorming with partners of like every conversation you have, asking who else can I talk to? Like who else is in your network that you can put me in contact with? But that also isn't comprehensive, that there's always going to be gaps with that. But I think just helpful to be able to build on current relationships.
Very helpful. Thank you. Annalise.
Thanks, Stacey. And thank you so much, Chloe. I'm going to piggyback off of Stacey's question. It really resonated with me whenever you said how much more effective advocacy is when it's not just an email blast and here's a form, call this person, and then, you never hear from them again. And I get those a lot too. I'm somebody who may feel activated by those calls to action, just depending on the cause. But I'm curious about where you look at the trade-off in terms of the amount of time and resources that it takes to do that really authentic relationship building through community engagement that you cultivated over time. You went to these communities, you spoke to people, you helped them recognize themselves in the work. And so when you did these like advocacy calls, people felt super connected to the work versus an email blast. Recognizing that takes so much time and energy and resources, and sometimes an email blast is easier. And I'm curious about your perspective on, how you could do something in the middle, or where you feel like if you had to prioritize time, where you would go.
Yeah, that's a great question. And you're so right that email blasts do serve many purposes. I think some people definitely are called to action with them. And I think also importantly, sometimes it's just about education and getting the word out, and that's not nothing. That often when, like, we know in human psychology, if you want someone to do something, they need to be asked a lot of times and reminded. And so that fills that purpose as well. I wish I had like data on how successful our email blasts were. My thought process with that, at least, was that I always felt like it was better to have 5 guaranteed yeses than 100 maybes, of just not certain if any of the maybes were yeses. And so if I could, in a moment, say, like, there's a committee meeting and in an hour, I need you to do something, and had 5 people I could call on, that guarantee was so nice to have. And so I think it's probably just all part of the advocacy plan, and where in the process these different approaches really do serve different purposes. But I think that those blasts do a lot. Like, the reoccurring reminders remind people of issues that maybe they're not as keyed into. And that's really helpful, of like, oh yeah, people are still talking about healthcare access or prisons or these things that I don't think about on a daily basis. And maybe it's the 20th time that they're like, okay, I feel like I know enough about this to be able to do something with it. And so, yeah, I appreciate the question.
Thanks, Chloe. Caroline.
I'll be quick. I know we're running short on question time, but I know typically in our echoes, we have clinicians involved, individuals that are clinicians that, may work for practices or organizations. So I just want to come at it from a different standpoint. Maybe some people here aren't part of a big organization and are trying to bring people in to, do advocacy work and work on policy change like your organization is and like mine at CareQuest Institute. So I'm curious what you would say is a good first step maybe for individuals or small groups, really start getting involved in the oral health advocacy space. I know when I first started, I was a clinician previously as a dental hygienist, and I worked a lot with my state's oral health collaborative as a way to get involved with advocacy before I joined an organization that does a lot of great work. So I'd be curious from your perspective, what a good kind of first step into this is for maybe someone who doesn't have as much experience or is just an individual trying to make a change.
I think first of looking around to see who's talking about issues that you care about. Is there an oral health group in your community or state or region that is talking about change that needs to happen or advocacy? That if those people haven't contacted you yet, that they would be absolutely delighted to hear from you, to say, I'm here, I'm a dentist, I'm a hygienist or assistant and want to learn more and be a part of this. That sometimes we don't always reach the people we're intending to, but that hopefully there's groups that already have some momentum and some opportunities for people to get involved.
Really helpful, thank you.
Okay, well, seeing no other questions, Chloe, thank you again for that wonderful and wonderfully informative presentation. As we shared at the start of the call, slides and this recording will be posted on AIDPH's website following the call, but don't leave yet because we have more. And Chloe, we would love to have you stick around as well. So we're now going to shift into the case presentation part of today's call. And Jasmine, if you'd go ahead and share the slides, thank you. I'm going to introduce our speakers who are both from the National Rural Health Association. We're honored to be joined by Zill Joyce Dixon Romero, who's Program Services Manager, and Alexa McKinley, who's Government Affairs and Policy Coordinator. And Zill and Alexa are going to share with us today a problem that they are looking for advice on. So take it away, Zill and Alexa.
Thanks, Stacy. And for those of you who don't know me, hi, my name is Zill. It's great to be here. And so today, me and my coworker Alexa are going to talk a little bit about the National Rural Oral Health Initiative, which is where NRHA houses our advocacy, policy, communications, and education portfolio regarding oral health in rural communities. And so just a little bit of a backstory on our Rural Oral Health Initiative. It is a combination of NRHA and CareQuest as we try to find solutions for issues that are plaguing rural communities. As I probably am regurgitating information at this point, where two of the major factors in rural communities that are, let's say, stopgaps in how they are not getting dental professionals in shortage areas are workforce and coverage, which affects about 31 million people in rural communities. So NRHA has built resources and ways to advocate on behalf of these communities, but it's a difficult time to get our resources out and hoping that people are utilizing the advocacy materials we are creating. So in this next few minutes, we're going to talk about two different things that NRHA is doing, one of which is some of the advocacy and resources that we have created. And Alexa is going to talk a little bit about some of the work that NRHA did regarding our physician fee schedule and the comments to the administration that we made. Next slide, please. So as we go through that, we just want to remind some of the asks for the group that we have, which is NRHA would love to hear some of the feedback that other national and state partners are developing as it comes to advocacy. We'd like to hear if others address the most recent physician fee schedule comment period to the administration, as well as advocating to state and federal lawmakers regarding policies surrounding that, as well as how, if your organization is a little bit smaller, or even if you are national level organizations, what are ways that you are advocating on comments and rules if you don't have a lawyer or policy advisor, and still finding ways to advocate in an efficient and effective manner. So let's go ahead and go to the next slide for me, please. So before I turn it over to Alexa, I just want to kind of go over a little bit about NRHA's current plan of action, which is that we're actively trying to engage and increase access and activities surrounding advocacy. We encourage our advocates to talk with policymakers and look for long-term solutions from grassroots at the dental professional level, and bring that and elevating it directly to the Hill, and learning about ways that they can advocate to their administrations and their state and local governments. As well as we're looking to expand Medicaid coverage in states that have not done so already, including over a dozen, with the majority rural communities per square mile. So trying to really push into that narrative that rural is important, you should be focusing on it, you should be increasing access, especially around dental. And then of course, as I've brought up, we're recently expressing interest in expanding Medicaid coverage for dental care through the 2023 Medicare physician fee scheduling proposed rule, which I will now turn over to Alexa to talk a little bit more about NRHA's advocacy materials, as well as our most recent comment period. Alexa?
Thanks, Sil. Hi, everyone. I'm probably a new face for most of you. So I'm Alexa McKinley with NRHA, and I work with Sil a little bit on our oral health initiative. So I'm on the government affairs team and kind of handle our policy and advocacy on the regulatory side of things. So that's kind of where my expertise comes in, and handling our regulatory agenda. And also, I just want to say that I apologize if there's a little background noise. I am at a conference right now. So first, I just want to start to talk about the Medicare physician fee schedule and NRHA's comments. So this was a really positive change that we're seeing, because we saw that the Centers for Medicare and Medicaid Services were interested in expanding Medicare's coverage of dental services. So generally, Medicare does not cover dental services for seniors, and this is really an issue impacting rural communities, because they typically do have older populations that are covered by Medicare. So what we saw in the physician fee schedule was kind of twofold. One was that they were proposing to pay for dental services that are inextricably linked to and substantially related to kind of other covered services. And then there was a request for information and comments on what those covered services should be. So NRHA kind of stressed how important it is for any dental and oral health services connected to diabetes or heart disease, because those are two really big chronic diseases impacting rural communities. So we primarily engage on the federal level as a national organization. I lead most of our comment writing and those kinds of things, but there's also other ways that you can engage on the administrative side of things. And I think Chloe did a really great job talking about how you can engage in grassroots advocacy and start to educate your communities. But like other individual steps that you can take, and get in contact with other advocacy groups or your colleagues, would be, you can comment on proposed rules, but there's also ways that you can send letters to different officials in the administration. So if you would like to advocate for further Medicare coverage of dental services that's kind of outside of the physician fee schedule, you can always send a letter to the administrator, Brooks LaSure, and CC other individuals. And it's really impactful when you have provider experiences, patient experiences, community experiences built into those kinds of things. And a big thing that we want to advocate for and encourage others in the oral health space to advocate for is equity. So as Zill talked about, really oral health in rural communities comes down to being a health equity issue. There's disparities in oral health outcomes and access, and rural residents on average are seeing a dentist or dental hygienist far less than their urban counterparts. So that's another thing that we really try to bring into our advocacy, and for example, emphasized in our Medicare physician fee schedule comment. And then of course there is the Hill side of things, which is not my favorite, but we have to engage there as well. And that's where a lot of the change really starts, right? Because rules and regulations can only be promulgated when there is a legal basis that came from Congress. So getting in touch with your policymakers, state and federal, and advocating for Medicaid coverage of dental services in your state, because right now there's—
Alexa, I'm sorry to interrupt you, but Jasmine, could you please advance the slide? Thank you.
Thank you. So getting in touch with your policymakers, there are bills out there that have been introduced. So these kind of cover Medicare coverage for dental services and some workforce and loan repayment for dentists. But something to keep in mind in your advocacy is that we're in the position right now where we're about to go into a midterm election, which means new Congress comes in starting in January 2023. So all of these bills that people have championed and advocated for need to be reintroduced. And so kind of the issue here is we need to find champions for them. Maybe they lost their seat or didn't run for re-election, or it's just not the top of their priorities right now. This is where advocacy and grassroots comes in, and getting together to contact them and find a champion for these bills so that we can reintroduce a Medicare Dental Coverage Act or repayment for loans for people who are practicing as dentists. So keep an eye on elections, and keep in mind that you can get in touch with your state delegation to make sure that these issues are continuing to be at the forefront of people's minds going into the 118th Congress. And then I think that's the end of ours.
So Alexa and I just kind of threw a lot at you there, which it's between a level of just really wonky policy nature of there's bills that are out there that need to be reintroduced following into the next year, and resources and from an advocacy base that's much smaller than a traditional population. So that's really more of where we're coming from with this. So as we go into our discussion period, we really hope that you keep just some of these things in mind as we talk more about them. And that's pretty much it for us. Questions, comments?
Well, I want to take us back to, since this is a case presentation, right? So I want to take us back to what's the problem that you're looking for this group to give you advice on?
Yeah, and so for us, that's just, we want some feedback about ways that other groups are disseminating information and getting, their advocacy. What does that look like, sound like, feel like? What are ways that other groups are submitting comments or directly advocating and lobbying their legislators at the state and federal level?
Okay, great. So I am going to say, since we're our group's on the smaller side today, I'm going to suggest that we stay in one room together rather than going into breakouts. A number of the faces and names on here are staff or presenters. So I'm going to ask if folks could put their cameras on. That would be terrific. And then why don't we work through the questions? We have a few minutes. So the first question is, NRHA would love some feedback on ways other national and state partners are developing advocacy and information dissemination tools. So can folks, who has some approaches that they're willing to share? And I'll also ask if any faculty want to share their guidance on this as well. We'd welcome that.
Also, from an NRHA perspective, we would love to hear if you're a part of, let's say, a state organization or a university that doesn't allow you to directly lobby. What ways have you been trying to advocate in, whether it be a local setting or elevating that up to your community members?
Great question. We hear that a lot, that challenge from folks.
Hello, everyone. Good evening. My apologies. I can't switch on my camera at the moment. My name is Cleopatra. I am a dental practitioner based in Zimbabwe, but have so much interest, and I am vested in global oral health. So at the moment, I'm currently in Zimbabwe, but the kind of work I do is oral health advocacy for the African region and in lower income countries. So I'm very passionate about dental public health, and my experience taught me that after working in the rural areas in Zimbabwe and being exposed really to all levels of primary healthcare delivery, I was frustrated by working one patient at a time up until I started working with the provincial medical directors, so as well as the medical superintendent for the hospital where I was. So they allowed us to actually start doing satellite clinics. This may be difficult for you to understand, but at the end of the day, we needed to meet the patient's oral health needs. So they couldn't all access the dental facilities at the provincial hospital. So we then decided to start partnering up with the ophthalmology guys, with the radiology guys, who used to have some form of support. They would get at least the ambulance to be able to go maybe bi-monthly to some form of mission hospital, a satellite clinic that previously was resourced, but fell off in terms of getting support resource-wise. So that's pretty much how I got into this kind of space. So from my experience, I then discovered that this possibly may be different from the US, but from my experience, and I'm saying this after having toured Kansas at some point in time, getting to appreciate that we have similar problems. What I appreciated was that in my country, or for the lower middle income setting, policy was lacking. When I then got an opportunity to work at the national level to be coordinating this, I discovered we can't develop policy without an evidence-based. So that's how I somehow got drawn into research. And currently I've been working on oral health research. For instance, at the moment, we have an oral health for mental health patients project to try and just bring in awareness for mental health patients that they also have oral health needs that are unmet. So this is the kind of space that we've taken. We're working with nurses, we're working with midwives, different healthcare practitioners, making them realize that, you know, it's not just about dentists or dental hygienists, oral health practitioners doing the work. We all have a part to play, even for admitted patients. So I don't know if this helps, but this is what I'm doing at my end of the world. And we're now doing a bit of collaborative work with Malawi, setting up its first national oral health policy, because these are the problems we're facing. So yeah, we're pushing in research and we're pushing in setting up policies as well in terms of oral health workforce development. I don't know if that helps, but that was my contribution.
Cleopatra, thank you. And thank you for joining us from the other side of the world. It's so interesting to hear about what the care delivery environment looks like in a place so far away from here. So thank you for that. Annalise.
Thanks, Stacey. And thank you, Cleopatra, too, because it sparked something in my mind that AIDPH struggles with, and I think most researchers struggle with, especially when we're talking about rural communities. Because I'm thinking through the asks, and I'm also thinking through Chloe's presentation, which was trying to bring as much information to the people as you can so that they feel invested in the work that's being done. We know that it can be difficult to reach rural communities for a lot of different reasons. And I know when it comes to AIDPH doing research, just finding data on rural communities is just such a barrier to then make your case for advocacy, and then involving those rural communities and having them, you know, take those efforts and be the voice and the face of the movement. I'm curious to see how NRHA has kind of woven that thread through in terms of finding the data and the research that you need to then make the cases, to then reach out to the rural communities for them to be able to advocate for themselves.
So I can address some of the issues that we've, some of that at least. The first component being is that we rely heavily on subject matter experts in the oral health field. But the problem is that with the sample size being usually pretty low, it's really hard to communicate. Well, we have this great study. We've got this great researcher who's done it. We've got this great subject matter expert. Now we need you to translate that into legislative action. And so usually that for us, that's come in the form of various different topic papers and compendiums of best practices that then we can share and circulate. Because for us, it's more of an awareness issue. And we feel once there's more awareness, it's that chicken and the egg problem. If there's more awareness, we can get more funding for research. If there's more funding for research, we can get more data. If there's more data, we get better policy. It's that endless cycle that we're getting. So for us, we've kind of settled on a starting point of start with topic papers and information sharing and rely on our National Rural Oral Health Task Force to elevate those discussions amongst, you know, either whether it be subject matter experts, local practitioners, federal policymakers, and have them have those conversations so then we can elevate the topic overall? That's a really great question, because all of that jumbling really was an answer of, we're trying, we're throwing things at the wall, hoping something sticks.
Yeah, and I can add a little bit onto that from the government affairs team standpoint. So data is, of course, like the gold standard. We always want to have that to back things up. But what's also really impactful is actual voices and experiences too, so anecdotal stories. So we've tried to get people involved, for me on the administrative side, by, and this wasn't in the oral health space, but it's something that can be applied for us in the future and other organizations. So we did comment templates so that members had a more accessible way to write comments on proposed rules. And instead of having to start from scratch, we created a template with like the most important parts of the rule for rural beneficiaries, and then they could fill it in with their voices and experiences. Because at the end of the day, for policymakers, what's really important is hearing from people on the ground who are affected by these things. So we love data, but we also do love stories as well.
Thanks, Alexa. And I want to call out in the chat from Dana Schaefer. In Pennsylvania, we've advocated on various policies through the PA Dental Hygiene Association's Governmental Relations Committee and through the PA Coalition for Oral Health. PDHA also has a lobbyist who advocates for hygienists as well. Thanks for sharing that.
Yeah, and kind of going off of that, I'd like to also go off something that Chloe brought up in their presentation about, you know, advocacy is really just trying to make everything more empathetic, right? And so if you can find other advocates who are in your area that are willing to go and be, you know, the foot soldiers, whether it be a Hill Day, or shameless plug to National Rural Health Day is on November 18th. But, you know, just doing things of that nature, it can really raise the level of awareness in your communities by just having one or two people talk to one or two more people about the issue. Anyone else? Questions? Maybe some feedback on what they're doing at even just the university level, if there's some researchers out there.
I'll add another comment because I was just analyzing some rural veteran data this morning, that what's been very helpful for us is following sort of Chloe's lead about partnering with the local organizations that are already there for data collection. Even though we still get really small samples, what we found is relationship building over time, coupled with authentic kind of partnerships and investment where there's shared power, transparency, shared data, typically gets us both the stories and the data that are helpful to then go into an advocacy situation. So I know I'm not at a university, but because it was fresh on my mind, it took so much time and energy and effort to get us there, to get the data, to then share the stories, to make the case. But I do think that the product for us has been much richer following that, that pathway.
And I'll go off that, Annalise. At CareQuest Institute, you know, we have the great position of being a national organization, but we work with a lot of different states and stakeholders within states doing just what you said, Annalise. In my primary area of work at CareQuest Institute is with our health improvement program, really working with dental providers, also medical providers and patients to collect, you know, on the ground clinical data that we can use for advocacy purposes. You know, once we've collected it and analyzed it and done all those great things, they're able to use and share with not only partners in the state to do advocacy work, but, you know, partners around the nation. So we sit in this really cool spot to kind of get to do both. And I know obviously our organizations are already great partners and really appreciate you guys, but you know, just anyone else on the call as well, just, you know, if there's any way that we can be a resource to you guys, we'd love to do that.
Thank you so much, Caroline. So seeing no other questions, I want to express my appreciation to Zil and to Alexa for sharing your work with us today, and to those folks who responded with questions. And ask Jasmine if you'll take us back to the slides, please. Terrific. So next steps here, I want to remind everyone that CEUs are available for today's session. You'll receive an evaluation and request form following today's call if you'd like to take part in that offering. Recordings and resources from today's call will be available on our website, and we'll also be sharing a summary of the ideas and recommendations that came out of our discussion just now. The next Rural Oral Health Echo Session topic will be oral health for individuals with disabilities, and that will take place on October 18th. And we encourage you as well, if you have a case that you want to present on a future call, to please go to our website and complete that form that you'll see there under the Echo Session, and we'd love to consider your case. And I also want to offer a reminder that you can earn a rural oral health certificate upon completing a number of assessments and taking part in several of these call offerings over the course of the year. So if you have any questions about this, reach out to us over email. You need to complete 8 competency evaluations to earn the certificate. And I think that's all we have. And with that, I'll thank everyone for joining us today, and we look forward to seeing you again next month. Take care, everyone.
Thank you.
Thanks, everybody.